Hello and welcome. Today we're delving into a serious respiratory condition known as radiation-induced lung disease. This condition can arise as a consequence of radiation therapy, often used in the treatment of cancers affecting the chest region. Understanding this disease, its causes, effects, and management is crucial for both healthcare professionals and those who may be at risk. Let's begin. The primary cause of radiation-induced lung disease, or RILD, is exposure to ionizing radiation during cancer treatment. When radiation is directed at tumors in the chest, such as those in the lung, breast, or esophagus, surrounding healthy lung tissue can also be damaged. The risk and severity of RILD depend on several factors, including the total radiation dose, the size of the lung area exposed, the fractionation schedule, that's how the total dose is divided into smaller daily doses, and the use of concurrent chemotherapy. Certain pre-existing conditions like chronic obstructive pulmonary disease or COPD and underlying genetic predispositions can also increase an individual's susceptibility to RILD. So, what happens at the cellular level? Radiation damages the DNA within lung cells, leading to inflammation and cell death. This initial injury triggers a cascade of events, primarily involving the release of inflammatory mediators like cytokines and chemokines. These substances recruit immune cells to the affected area, further exacerbating the inflammation. Over time, this chronic inflammation can lead to fibrosis, a process where normal lung tissue is replaced by scar tissue. This scarring stiffens the lungs, reduces their elasticity, and impairs their ability to efficiently exchange oxygen and carbon dioxide. This entire process ultimately hinders the lung's normal function. While precise figures are variable depending on cancer type and radiation protocols, radiation-induced lung disease is a relatively common complication following thoracic radiation therapy. Estimates suggest that a significant proportion of patients undergoing radiation for lung cancer, breast cancer, or lymphoma experience some degree of RILD. It's important to note that advancements in radiation techniques, like intensity-modulated radiation therapy or IRT, aim to minimize the exposure of healthy lung tissue, potentially reducing the incidence and severity of RILD. However, it remains a significant concern for many patients. The signs and symptoms of radiation-induced lung disease can vary, depending on the stage and severity of the condition. The acute phase, known as radiation pneumonitis, typically occurs weeks to months after radiation therapy. Common symptoms include a dry cough, shortness of breath, especially with exertion, chest pain, and fatigue. As the disease progresses to the chronic phase, radiation fibrosis, the symptoms can become more persistent. Shortness of breath worsens, often becoming a debilitating symptom. There may be a persistent dry cough, and in severe cases, patients may experience significant limitations in their daily activities due to reduced lung function. It's crucial to report any of these symptoms to your healthcare provider if you're undergoing or have undergone radiation therapy. Diagnosing radiation-induced lung disease involves a combination of clinical evaluation, imaging studies, and sometimes lung biopsy. A thorough medical history, including details of radiation therapy, is essential. Chest X-rays and CT scans of the chest are used to visualize the lungs and identify characteristic patterns of inflammation or fibrosis. Pulmonary function tests, or PFTs, are performed to assess lung capacity and airflow. These tests can help quantify the extent of lung impairment. In some cases, a bronchoscopy with bronchoalveolar lavage, or BAL, and lung biopsy may be necessary to rule out other conditions, such as infection or tumor recurrence, and to confirm the diagnosis of RILD. Radiation-induced lung disease can be broadly classified into two main phases: acute radiation pneumonitis and chronic radiation fibrosis. Radiation pneumonitis represents the initial inflammatory response to radiation injury, typically occurring within 6 months of treatment. It is characterized by alveolar damage and an influx of inflammatory cells. Radiation fibrosis, on the other hand, is the long-term consequence of chronic inflammation and tissue remodeling. It involves the deposition of collagen and the formation of scar tissue, leading to irreversible lung damage. Some classifications also consider the severity of RILD, ranging from mild with minimal symptoms to severe with significant functional impairment and respiratory failure. The treatment and management of radiation-induced lung disease depend on the severity of the condition and the phase it is in. For radiation pneumonitis, corticosteroids, such as prednisone, are often the mainstay of treatment. These medications help to suppress the inflammation in the lungs. Oxygen therapy may be necessary to improve blood oxygen levels. In more severe cases, hospitalization and mechanical ventilation may be required. For radiation fibrosis, treatment options are more limited. Pulmonary rehabilitation programs can help improve exercise tolerance and quality of life. Bronchodilators may be used to open up the airways and ease breathing. In some cases, antifibrotic medications, which aim to slow down the progression of fibrosis, may be considered. Lung transplantation is a last resort option for patients with severe end-stage radiation fibrosis. Preventing radiation-induced lung disease is a critical aspect of cancer treatment planning. Modern radiation techniques, such as IMRT and proton therapy, allow for more precise targeting of the tumor, minimizing radiation exposure to surrounding healthy lung tissue. Careful treatment planning, including dose optimization and the use of lung shielding, is essential. Before starting radiation therapy, patients should be assessed for pre-existing lung conditions and risk factors. Smoking cessation is strongly recommended, as smoking increases the risk of RIL. During and after radiation therapy, patients should be closely monitored for any signs or symptoms of lung injury. Early detection and intervention can help minimize the long-term effects of RILD. The prognosis for radiation-induced lung disease varies depending on the severity of the condition and the patient's overall health. Mild cases of radiation pneumonitis often resolve with corticosteroid treatment and supportive care. However, more severe cases can lead to chronic lung damage and significant functional impairment. Radiation fibrosis is generally irreversible and can progressively worsen over time. Recent research efforts are focused on developing new therapies to prevent or reverse lung fibrosis. Studies are exploring the potential of novel antifibrotic agents, immunomodulatory therapies, and stem cell-based approaches. Furthermore, advances in imaging techniques and biomarkers are helping to improve the early detection and monitoring of RILD, potentially leading to more effective interventions. The ongoing research in this field offers hope for improved outcomes for patients affected by radiation-induced lung disease. Thank you for watching.